promises of aid, but promises don't always amount to action. That's the sad story playing out now in each of the three countries hit hardest in the Ebola epidemic. Sierra Leone, Guinea, and Liberia are all lacking everything from personnel to special hazard suits to even the most basic health care. Those on the ground treating people in places like Liberia say the scenes around them would be unbelievable if not for the fact that it is real. Paramedics in Liberia don't have a place to take their patients. Treatment centers open only to be filled up hours later. The United States has pledged more than any other single country. The president of Liberia says she hopes the decision by the United States to send thousands of military personnel will spur the rest of the international community into action. She also says the entire community of nations has a stake in ending this crisis. China is sending a few dozen more personnel.
We sent out 59 more medical workers this time, and China now has a total of 174 medical workers in the Western African countries. China will continue to work with the international community and contribute to the early control of the Ebola epidemic.
China is among the nations being pressed to do more. Others include Germany, which is still just considering whether to provide a mobile hospital and transport planes. CCTV's Katerina Vittozzi has insight from Ghana.
These are the basic weapons in the fight against Ebola: masks, aprons and rubber gloves. But for months, healthcare workers in Liberia have been losing that fight, and the virus has spread uncontrolled, killing more than 1,000 people in this country alone. Treatment clinics are stretched beyond capacity and turning patients away. They don't have the space or resources to treat all the sick.
Whole day I receive call from the community. I say when we have cases which you are here sick and you are no longer coming to pick up this for me. I have to tell them I can't do anything otherwise because I can't handle the situation by myself, or my team cannot handle the situation right now.
In response to the crisis and urgent appeals from Liberia, the United States is sending help. 3,000 troops will head up a command center in the Liberian capital, Monrovia. There they will coordinate supplies, logistics and personnel. They'll build new clinics and help train local healthcare workers. The US military will move into the countries worst hit by this Ebola outbreak: Guinea, Liberia and Sierra Leone. There they'll work alongside the governments of Nigeria and Senegal. But other governments in the region are stepping up too. They realise this isn't just a health risk, it's a security risk too for the whole of West Africa. Ghana, which currently heads the Economic Community of West African States, stands ready to do its part.
We, the military, we are also on the alert and we are standing by to give whatever support we can. Indeed, our president, who is also the chairman of ECOWAS, has mandated us to stand by, and he has made Ghana the hub of aid and assistance to other countries in the sub-region who has the challenges of Ebola.
There is no known cure for Ebola. Clinics work to alleviate symptoms like vomiting and fever. If treated early, survival chances improve. So with the World Health Organization predicting that thousands more will become infected in the coming weeks, stepped-up support for clinics is vital to improving the outcome for these patients. Katerina Vittozzi, CCTV, Accra.